Okay. Please keep your arm here. Yes. A little bit in this. Stop it. In this position. Yes, perfect. And you see, this is the clavicle, and this is pectoralis major, the clavicular part. This is deltoideus, and this is the Mohrenheimsche Grube. I don't know if it exists also in English, but this is particular. There is a little space. You give resistance, you can see better. Here we have this superficial part, clavicular part of the pectoralis major, and then there are the other part, the sternoclavicular part and the abdominal part. Okay. The muscles forms the anterior shoulder fold, and if I take it like this, I have all parts together. This is very comfortable, very easy, you can practice like this.
이렇게 잡으면 전체 섬유를 다 잡을 수 있습니다. 이거 되게 쉽다고 합니다.
You see, I can move very comfortable here, and this I can use during the diagnostic procedure.
이렇게 자꾸 움직이는 게 이제 이거 진단할 때 가장 쉬운 그 베스트 포지션이라고.
We said as first we are looking for taut bands.
일단 타우트 밴드 찾아야 돼요.
And if I move like this, first there are the taut bands which are stretched. When I make a little stretching, the first structure is stretched, the taut band. And so I can examine very easily and find the taut bands.
이런 식으로 살짝 스트레칭하면서 어디 타우트 밴드가 있는지 느낍니다.
Okay. And then I go and I identify the taut bands again. It's okay?
괜찮나요?
If I have a taut band, I'm looking for painful areas. It's equal, every part, or where is
No.
more? Here is more?
Yep.
It remains local, or does it refer
Local.
local? Do you know this pain?
No.
No. So it's no trigger point in the course between this. Okay. And you see, I have again this piercing or pincer grip because I can reach this muscle very easily in this way. Now I can move like this. Which technique I perform?
저 무슨
To be.
To be, exactly. And here, this works very well. It's easier to move here than to move here. And I'm looking for the easiest way. This is very comfortable.
저희가 요거 할 때 제일 쉬운 거 한번 찾아봤는데 지금 요 형태 핀치 그립 사용해서 이렇게 하는 게 가장 쉬워요.
Left.
Hmm?
Left.
It goes to the finger?
Yep.
Okay. Then it could be because of the pressure or because of the position. So it remains in the finger. Irritation?
손가락
끝에 여기.
Okay. Then I remain in the position but without pressure. It remains in the finger.
이렇게 압력 없앨 때도
Remove.
remove the pain.
Yes. So I know it's not the position. Okay. I changed just one part. I released the position. I rested in the position, but I didn't press anymore. It's okay now?
Yeah.
Okay. And now I know it's not a nerve problem, because if it would be the nerve in this position, it would remain. So I am searching again. So you have here a latent trigger point with an irradiation in this part.
이게 만약에 신경 문제였으면은 이렇게
Here I can
포지션은
feel.
유지하고 압력은 뺐을
Left.
때 이게
It
유지돼서
comes again.
통증이.
You see, it's for sure the pressure and not the position. I can release again. Does it go away?
Yeah.
Yeah. It's not a neural problem. For sure. This is caused myofascial.
다시 반복해봐도 힘 줬을 때나 뺐을 때 힘을 줄 때 통증이 있고 압력을 뺐을 때는 통증이
그렇죠.
없어지니까
It comes again.
이거는 마이오파시아다.
Do you know this from your everyday life?
No.
No. Not a problem. No problem. Okay. Treating, I could continue like this. It gets worse.
계속 심해지나요?
Equal.
Equal. Treatment would be like this, slowly, slowly. Equal or worse or better?
Decrease.
Decrease. You see. This would be treatment. Okay, this is this part. This is most common, very easy. If you want to examine just this clavicular part, sometimes it works, sometimes it doesn't work. You can try it here again, you take it here, and sometimes you can take just this part like this, or you go through behind this muscle and you have just this part. But here I can't take it isolated, no problem. I would take it like this, clavicular part. Then we have here the sternocostal part, and there sometimes is the irritation and the trigger points are very close to the ribs. It's on the insertion side where there are the problems.
간혹 가다가 요 갈비뼈에 가까이 붙어 있는 스터너 파트에도 트리거 포인트 문제가 있다고 합니다.
This sometimes is a very local problem here. In German literature, it's as Tietze syndrome. Don't know if it exists also in refer.
Yeah.
Where? Again.
Yeah.
Okay. And now I don't know, you see, I press the muscle, but not only the muscle, I press also the ribs. And the ribs, there is a connection behind to the spine, and so I have to differentiate, is it the pressure on the muscle or is it mobilization of the rib and probably of the spine. It goes away.
갈비뼈가 척추에 연결돼
Okay.
있어서 이게 척추
And
모빌라이제이션에
you
대한
see-
것도 효과를 줄 수 있기 때문에 우리가 근육을 누르는지 닙을 누르는지 명확히
Now I perform the same movement of the rib, but with a flat contact, not with a point of. Does it irritate to the arm?
No.
No. So now I know it's not an articular problem, but it could be. I have to differentiate step by step. But now I know it's not the mobilization of the rib or of the vertebrae, and now I go again. It comes again?
Yeah.
Okay, now I know it's a myofascial problem, but I have to differentiate every time. Is it a joint problem, a myofascial, a neural problem? And we can make this task, in this case, without problem.
척추 모빌라이제이션을 또 따로 해봐서 그게 이제 증상이 있고 없고에 따라서 이게 관절 쪽의 문제인지 마이오파시 문제인지 구분하고 지금 보이는 것처럼 여러 원인에 의해서 증상이 나타날 수 있기 때문에 우리는 구분을 해야 되고 충분히 연습하면 할 수 있습니다.
Okay, so the treatment would be here, like this. Which technique?
어떤 기법이죠 지금?
2A, exactly. And you see here I can't perform a 2B, so I don't practice it. It's no problem. I don't have to make every technique in every case, but I can adjust it here. It's very comfortable to practice the technique 2A. Okay. Then we have from here, I can follow the muscle in this area.
이렇게 근육을 따라가면서 만질 수가 있는데
Okay. And With ladies, I have to say if it's comfortable, I can continue, and you have to go under the breast tissue, and it's no problem because you feel the muscle here. But if the lady don't want that we treat here, it's no problem. They can say stop, and then we will not treat.
Oh.
But here often are trigger points. And
그래서 여성의 경우에는 저 지점 그 밑에 지점까지는 치료하는데 한계가 있어서 당연히 이제 뭐 어떤 이유에서든 동의를 구하지 못하면은 저 밑에까지는 안 해야 됩니다.
yeah, in German-speaking part of Europe, it's no problem to treat like this. But in French or Italian or English-speaking part, you can't work like this. It's very different from culture to culture, and we have to respect this. It's clear.
독일에서는 별 문제가 안 되는데 이제 프랑스나 다른 데서는 문화적인 차이로 인해서 그렇게 하지는 않았다고 합니다.
But from a medical point of view, it would be very helpful to treat here, because one of the causes for the overlead is to keep things in this position. And if you work in a restaurant, you keep all day like this, and then you have these problems. You get shoulder, arm pain, and you can't work anymore. And these are often ladies, and you have to treat them in the whole chain of the problem. So you can practice this very well. Then we have this part. Please go with the hand behind the neck. Okay. And in this position, yeah, you can go down. It's a stretch of the muscle. Patient often can't go as far as you. Then I put here a cushion to put it.
이렇게
Please.
이렇게 스트레칭, 프리 스트레칭을 하고 기법을 적용할 수가 있는데 만약에 환자가 요만큼 멀리 팔을 못 뻗는 상태면은 요 밑에 베개 하나 깔아서 시작하면 됩니다.
Yeah. And then you come up with the elbow and down. And up
지금 저항 검사하고 있고요.
and down. And up. And then I can feel here the contraction of the muscle, and I can treat it if necessary. Okay. Then we have the facial separation techniques. We perform today just one. There would be 3 parts necessarily. There is the separation from the pectoralis major, from the deltoid. Then separation pectoralis major to pectoralis minor, we don't practice today, and the separation from pectoralis major to here coracobrachialis biceps carpus breve, we don't practice it today. Today we make just the separation between the pectoralis major and the deltoid.
이 부분에서 이제 우리가 근막 분리 기법으로 분리할 수 있는 구조가 3가지가 있습니다. 펙토라리스 메이저, 마이너, 델토이드, 앞섬유가 있는데 오늘은 이제 마이너하고 메이저 구분하는 거는 연습 안 할 거고요. 이제 메이저하고 델토이드, 앞섬유하고 구분하는 것만 연습할 겁니다.
It's enough for today. But try to release the muscle, no stretch, and then I take the muscle between 2 fingers and I follow the tendon of the muscle up to the bone, that I can feel here the humerus, and then I'm in the correct position between, here is delta, plomb, this is deltoideus, and I'm between the pectoralis major and the deltoid. And if I am here on the bone, then it's appropriate to go in a little stretch, but I'm just entered, and then I can make here a technique 4. This would be a technique 4B. I move here, or I can stay here and move like this. This would be a technique 4A. It's the same as with technique 2A, 2B.
우리 테크닉 2A랑 2B랑 구분했던 것처럼 4에서도 우리가 그 근육 범위를 가동 범위를 가져가냐 안 가느냐에 따라서 테크닉 4도 A랑 B로 나눌 수가 있습니다.
Is that? Okay. And then we have the technique 3. We go in pre-stretch. For the clavicular part, I go in transversal abduction, and I go in this way. It's okay?
예.
프리 스트레칭하고 기법 3 적용할 수 있습니다.
This is for the clavicular part, and for the rest, I go in diagonal abduction.
이렇게 대각선 벌림에서도 적용을 할 수 있습니다.
Also in pre-stretch. It's okay?
A little bit pain.
Okay. Technique 3. It's okay?
A little bit pain.
Slowly, slowly, slowly. Okay, so first pectoral smile identification. You keep your arm here. Orientation clavicle. Pectorals major clavicular part. Deltoideus. You start with this, and then you go around.
먼저 이 포지션을 유지해가지고 팩토리스 머슬이 어떻게 생겼는지 확인을 합니다. 그래서 클래비클 밑에 있는 클래비클 파트 섬유를 먼저 찾는 걸로 시작을 해가지고 실습해 보겠습니다.
Okay.